Story of BVMI is really a powerful story of people helping people. Here in Bergen County, New Jersey, there are thousands of people who don't have the funds or the resources, even though they're hardworking, to pay for health care insurance or have a private doctor of their own.
BVMI serves people who fall between the cracks, using a model that is incredibly simple but powerful, using volunteer physicians, nurses, and other staff to provide free health care to people who are working hard but aren't eligible for care. We started as an idea. If you trace the history of BVMI, it really was an idea of Sam Cassell.
BVMI was created by a group of us in 2004.
I actually, funny story, worked at the volunteer center at that point in time, and I remember Sam came to visit us, and they had this crazy idea that they wanted to start a healthcare center that was staffed entirely by volunteers. And I remember, I met with them, but I'm thinking, these folks are crazy. This is never going to work. And 6 years later, in 2009, BVMI actually opened its doors.
It started without a space, without an executive director, no patients, no staff. It was an idea.
A lot of it in the beginning was figuring out process, especially what I was doing, the referrals, which are a big part of what we do if a patient needs to see a specialist that we can't handle here. And that was a process, figuring out exactly how to do it.
It was so rewarding after we opened to have this idea become reality with a physical space. But what was even more, I think, rewarding for the board was to see people coming in, real individuals, and hearing their story.
If BVMI wouldn't be a part of us.
Wow. I think that I'm just dying.
Yeah.
Really, I was going to be in blind because I didn't know to go. I had to pay from my pocket and it's too expensive.
I'm actually amazed how they are meeting a lot of the challenges and needs of people and their health because they are addressing the whole person, which health. We spend a lot of time with our patients and we know a lot about them because they get to know us, they're comfortable with us, and we really can find out all their needs.
We have a beautiful new center, and it's kind of crazy to say this. We know there's a lot of people out there who don't know about us or haven't found us. And if we're going to be here, we need to serve them.
BVMI has a wonderful phrase which is called the culture of caring, which is really about not just providing medical care for our patients, but doing it in a way which makes them feel happy, knowing that they are cared for by people who are interested in them.
Well, we are guided here by the culture of caring. You feel it from everyone. Everyone cares about the patients.
You just walk in and it's like you're getting a hug when you walk in.
Volunteering at BVMI is the highlight of my week. I start on Mondays, so it just starts the week out right.
I think the best way to convince people to get involved and be supportive of BVMI, whether it's writing a check or volunteering or helping out on an event, is just to come visit. You have to see what's done here. Statistics are one way of telling the story, but I think the better way to do that is just the case histories of people and how they found us, how we helped them, and the difference that it made in their lives.
It's like God opened the skies. It's like, this is BVMI, and they embraced me and they helped me.
Everybody who doesn't have health insurance should be able to come here or allowed to come here because I think you guys are fantastic. And if I had my way of advertising it, I would get one of those planes that you see down the beach with the sign that they're pulling that's, got the name and the phone number, and I would put it all out there because I think that's how great you guys really are.
To see the organization grow and thrive and be an important part of healthcare in Bergen County is terrific.
I feel blessed to be a part of it.
The biggest challenge of any organization, as well as BVMI, is the ongoing quest for funding. as we've grown, our budget has grown.
We're only scratching the surface right now of need. We serve about 1,000 patients at BVMI, and there are probably another 25,000 who could benefit from our care. And that takes extra funding. Each year we start out with a clean page. There's no other revenue coming in from the government or insurance companies. We have to raise our budget every year.
I'd love to have 2,000 or 3,000 people coming here. I hate that they have to come here because they don't have access to healthcare anyplace else, but really, I want more patients. That's my biggest dream.